and I am the Marketing and Community Relations Specialist with Centers for Dialysis Care in Cleveland, MOTEB. I have the privilege to coordinate outreach programs for the Community Vaccination Education Program, which is grant funded by the Centers for Disease Control Foundation and the Centers for Dialysis Foundation. The overall goal for the Community Vaccination Education Program is to increase confidence in the COVID-19 and influenza vaccines in targeted communities and getting more adults and African American populations protected against COVID-19 and influenza. For more information about Cleveland MOTEB, check us out online at clevelandmoteb.org or like us and follow us on Facebook at Cleveland MOTEB, or please call me directly at 216-658-0727. Today, I would like to welcome our podcast guest from Ward 7. Today, we will be having Councilwoman Tiffany Howse. She will be coming to join us shortly, but we're going to start off by talking with Shauna Roberts, the office manager of Famicos Foundation. I would like to thank both of them for taking their time out of their busy schedules to weather the storm and be here with us today. And so we'll start with Shauna, and she's going to tell us about Ward 7 and, what neighborhoods does Ward 7 cover and the important work that she does in the community.
Hello, everyone. My name is Shauna Roberts, and I am the office manager for the Ward 7 community offices with Famicos Foundation. And part of my role and work that I do with Famicos Foundation is coordinating and collaborating events and programming for Ward 7 that Famicos wants to have implemented, as well as coordinating things that the councilwoman would like to see in place. And since the pandemic, I have worked very closely with you, Tiffany.
Yes.
And other healthcare organizations like the Cleveland Department of Health, Cuyahoga County Department of Health, and different healthcare facilities such as Neon to coordinate vaccine clinics within the community of Ward 7, which stretches as far as Euclid Avenue, but it goes as far as Euclid Avenue to here 71st, where we are, to St. Clair Avenue, and it goes as far east as, I won't get into the dynamics of all of that, but we have a pretty large footprint covering the Huff community, Superior, St. Clair, and parts of downtown.
Okay.
Yes.
That's a large territory.
Yes, it is.
Okay.
And we have about 25,000 residents in our community.
Wow.
Yes.
Okay. Wow. Thank you. That's probably why things are broken up in wards, because Cleveland is so big.
Yes.
So
yes.
That makes sense.
Yeah.
How has Ward 7 been affected by COVID-19 throughout the last 3 years?
Oh, goodness. That has been a very trying time for our residents, and even for Famicos, as we've had to face some of the challenges from us being even more of a food desert. Unemployment rates have risen, had issues with a large majority of our residents passing away from COVID before the implementation and rolling out of the vaccine clinics. And even once we started that process, our residents were very hesitant to take the vaccine. But as time progressed, it's become a little bit easier, but we've had a large population of our residents that passed away from the actual virus.
Yeah. I know the clinics have definitely helped, after getting the vaccination clinics, just getting information to be trusted and getting that information out and educating the community and becoming a trusted source for the community, because, people contracting the virus and their families, you want to save. Just one death is just one too many. And so that was me being new in the community, being there, working with you all, had just, started my career off. It just was an experience. I can't even write it down and bottle it up. Being there for taking those community members one by the hand, as tell them what you experience, and that they're going to make it through, and the side effects of what a vaccine can do, or versus the effects of contracting COVID. Just having those personal conversations is just really, really meaningful, especially when you look like them.
Absolutely. It's been my experience that because we have been in the community, I've worked in my role for the past 5 years, it'll be 6 years next February.
Okay.
And it is really crucial, and people depend on those relationships and bonds that you have created with the community members and residents. They look to you for advice and direction. Well, Mrs. Roberts, should I take this vaccine? Well, I don't know. They could be trying to poison us. Because of our history and how government has done African American people in the past. We have a huge mistrust when it comes to something new of this nature. And then the vaccine was created very quickly. A lot of the community residents were hesitant. Like, it was created too quickly. I don't trust it. They're trying to kill us off. This is one way that they're going to do it. It's going to alter my DNA. There were so many misconceptions about what the vaccine would do for you, and or do to how it would impact them physically. And one of the things that really triggered me to get it, because I was kind of hesitant myself.
Me too.
I saw so many people pass away from it. And during the pandemic, Famicos, we were open. We did not close. Were considered to be frontline workers. So because of the residents that I knew personally that had passed away from it, I have children, I have a family that I had to go home to with grandchildren. I had to make sure that I was keeping myself safe to go home to my family. Because I don't know what I would have done if I had contracted something from somebody coming in to see me, and because I was not protected. So I think about my children, my husband, my grandchildren, and just impacting the people that I love. So if the risk of not having the vaccine, didn't outweigh the risk of taking it. I'd much rather have taken it to protect myself and my loved ones.
I agree.
But so many of our residents, they really depended on us to give them some directions, and we were really fortunate because the clinics and the healthcare organizations that we connected with to coordinate the vaccine clinics, those nurses, they were so extremely helpful in advising the residents of how this is going to impact them medically. They asked questions, and those nurses were always very, very friendly and upfront. And if for some reason that the resident wasn't satisfied with what the nurse told them, of course they weren't obligated to take it. But the nurses helped tremendously to give the residents information so that they will make an informed choice as to take it or not. And so many of our residents have pre-existing conditions such as diabetes, high blood pressure, and things of that nature that's prominent in our community. So those people are at higher risk. So it benefit them to take the vaccine, to be safe. So and a lot of our older residents, we have a large population of residents that live in apartment buildings, and some of our apartment buildings were hit hard with it, and they're senior populations, people that are disabled and senior citizens. But because they're in that confined place of being in the apartment building, sometimes that the virus kind of ran rapid there.
Absolutely.
So we had quite a few residents that lived in the apartment buildings that passed away. But one of the blessings with working with an organization like yours is that we were blessed to do vaccine clinics directly at the apartment buildings.
Yes.
So we didn't have to worry about the residents having to get transportation, or we met them where they were.
Yes,
And when
that.
we would have big events like our food distribution that we have monthly, we would have clinics there. So it was really beneficial for us. So we found out early on that we had to meet them where they are, where they were, to service them and to provide them with the best care possible. So
and it provided such an opportunity to while they're waiting in line for food, you can have that conversation. They're showing up for one thing, and you can just ask those questions. And sometimes I saw that, they may have not came for a vaccine. They may have came back and made a decision an hour or two later that
yes.
I'm coming back to get that vaccine.
Yes.
So you're not forcing, you're just planting that seed.
Exactly. Yes.
So that's really powerful. You answered. I have my little guide here. We didn't went into.
I went on beyond.
We answered a number of things. We answered hesitancy. We answered people of color of being at more risk for COVID-19. Have you seen, now that time has went on, has it been harder now to get the community vaccinated as opposed to when we first started, even with the, I don't want to say incentives, but gift cards and things?
So I will say that incentive has helped.
Yes.
Tremendously. Because we're in a financial situation that our community is in, where we have a high population or large percentage of unemployment and people on public assistance, and people need any little bit, even if it's a $25 gift card helps, or a $50 gift card. So that incentive has been major and been definitely instrumental in convincing people to get the vaccine, because it has impacted them financially. But I will say also that as time has gone on, it has become easier because the people talk, and a large majority of our residents are older, and they will get on the phone calling their neighbors or their girlfriends or their church members to say, hey, I got my vaccine. I didn't have any reactions to it. So, if I were you, I would get it. And Famicos is going to do it, and they're, giving away gift cards. So it has definitely become easier as time has gone on for us to get people to get the vaccine. It's not that hard to convince them, I will say.
Right.
But it is always still helpful to have those people that the residents are familiar with, to be on the front line with them, at the actual clinic where the event is taking place. And we continue to work with wonderful nurses that are very well informed and have the patience of Job to administer the vaccine, because I've even noticed some of the people, I'm afraid of getting shots, and they don't like needles, they don't like getting shots, but our nurses that we've utilized have been tremendous, so that helps as well.
At one of the clinics that you did at the apartment buildings, I love how they look out for each other. And one of the residents said, go wake such and such up. This they nap hour, but go wake them up so that they don't miss the opportunity, because they need their shot. And I love that. I love the community. Yes. And also how elderly people, they become ambassadors to say, look, you get vaccinated to protect us, because maybe they're older and they can't maybe get vaccinated, but the people around them, their family, the young folk, they have to get vaccinated for the elderly.
Yes.
And so they don't have a problem biting their tongue and telling us young folks to get it together. And that's what I love, the wisdom that our our wise ones have.
Oh yeah.
So
Oh yeah.
I'll sit and listen to them all day long.
Oh yeah. Oh, yeah. The stories are hilarious.
And every time I have the opportunity to serve at any of the residential vaccination clinics, I say thank you for inviting me to your living room, because that's what it feels like, the lobby area.
Yes.
I say thank you for inviting me to your home, because it is just so it's always a good time, and they love our t-shirts too. And I say now make sure you wear it. It's a conversation piece.
Right.
So so that's a great thing. Are there any other concerns that you are hearing or addressing in the community currently other than COVID-19?
Well, you know what? We've been really fortunate with some grants and funding that we've been able to get at Famicos Foundation. So the vaccine clinics that we have now, they don't only provide vaccine for COVID-19. We do pneumonia, flu, shingles, and there's one other. I'm sorry, got to look at my notes.
No problem. Look at your guide. I'm holding on to my pneumonia, shingles.
Oh, goodness. Oh, God,
wait, shingles, pneumonia, flu, COVID.
And monkeypox.
Oh, yeah. Why?
Yeah.
That's
so
right.
we've so our vaccine clinics, if the residential place that we're going to, or even a community area that we're going to, or a facility that wants to have a vaccine clinic, they have an option to choose, multiple vaccines, not only the COVID, because they're with those people that are still kind of leery to get it. Some of them may get a flu shot or a pneumonia shot, so that opens it up. But it's also been a blessing, because we have found that doing the vaccine clinics at the different residential places, that some of the women in particular is like, well, if y'all bring a mammogram mobile here, I'll get my mammogram. So we're starting to arrange those now as well. So it has been a great opportunity to provide more than just that service, to our residents, because they need so much. And because transportation is a barrier, a real barrier for a lot of our community residents, it's a blessing to be able, again, to meet them where they are and bring that service to them at no cost.
Right.
So with the amazing work of our grant writers and things that we've received funding to provide those services. Okay. And then we have a couple of new staff that are community health workers at Famicos Foundation, and they are doing a phenomenal job to help arrange all of those clinics as well. That's good. So it's been a blessing. So it's not only the COVID vaccine, but the other ones as well.
And did you all just did a resource event as well? Is that a part of Famicos or a different?
Yes, okay. That was a part of Famicos. That was a resource fair that they did back in December. Okay. And there's something else that's coming up that the councilwoman is doing on February 4th at East Professional Center. It's going to be an expungement clinic as well as a resource fairs with the utility companies. Okay. So that's definitely something that people should come out to. And that event starts at, I think the expungement clinic starts at 10, from 10 to noon, and then the other event starts at noon, from noon to 2. Okay. I think. Yes.
Yeah, we'll post that information because the one that was in December was a very unique event, helping with housing and utilities assistance. You don't get that often, where you can do your vaccination, some screenings, and some housing assistance as well. So
and we'll have more of those coming up this year, and as they come up, I'll make sure that you get that information, because we need to continue our partnership.
Oh yeah, for sure. Thank you. Anytime. Has COVID-19 affected you personally and or professionally?
Professionally, yes, because we work like we worked like crazy during the pandemic. It was very stressful, where everybody was able to work remotely. And not having the opportunity to do that. But I'm really blessed. I truly love the work that I do, so it didn't bother me. To still work, even though a lot of people were, a lot of places shut down and places closed. I felt, blessed to still, first of all, have a job.
Yes.
Because so many people lost employment during
That's
the pandemic,
right.
but because we are serving the community and people are in such need, it was nothing for me to do it. So I had my moments when I was stressed, and my family was like, "Do you have to go to work? All of this stuff is going on." I was like, "No, I gotta go, but it's fine. It's fine." So I'm blessed to have amazing coworkers and the leadership that we have in John Analifo, our executive director. He's amazing.
Yes.
And it makes my work not necessarily easy, but I love my coworkers and the work that we do together. So it was kind of hard, but we all stepped up and did what we needed to do to continue to help to improve the lives or quality of life of our residents that we serve. So it was a bit of a challenge there professionally. But on a personal note, I had family members that came down with COVID. I was so blessed and fortunate that no one lost their life, with the sickness. But I did have some people that were sick. And my sister actually just in December was sick right at Christmas time, and she was in the hospital for 8 days with it.
Wow.
And I was very afraid for her.
Yeah.
She's an insulin dependent diabetic, so she's got underlying risk factors, and she's 61, so that's a higher risk as well. But thank God, he brought her through, and she's fine. But she works in a skilled nursing facility, so she gets her vaccines on a regular basis and is tested on a regular basis. So they caught it very early on.
Okay.
So but she did have to spend that time in the hospital. But it was I've had a few other family members, but nobody as close as her.
Yeah.
To get it and to go see her in the hospital. My other family members were kind of leery to go see her because it's COVID. But I'm like, it's my sister, I gotta go see her.
Yeah.
But to go see her, and you literally, I don't know if you ever visited anybody that was sick in the hospital with COVID.
Oh, I worked in there.
Oh, you gotta put on like a hazmat suit
everything.
to go in, and and it's like, what? And it's like, well, my sister's like, don't hug me, and I'm like, it was just very hard.
Or even no visitation. I was in a hospital where it was no visitation at one point.
I think it's because it was so late, because this just happened in December, just before Christmas, that a lot has changed with the protocol. But they only allowed her one visitor. And for her to be in there at Christmas alone, not having any family there, it was difficult. It was very, very difficult. But praise God, she made it through. And I'm so thankful.
I'm grateful too.
Yeah.
Please hug her.
Oh, I will.
And especially the work that she does, because before I did this work, that's the environment I worked in, was the hospital.
Okay.
And it just takes a toll. We forget to take care of ourselves. We burn both ends of ourselves, and that self-care, if we don't learn it, we learn it
the hard way.
We'll end up being a patient in our own hospital bed.
Right.
But it's real.
Right.
The hospital beds being at capacity, it is a real thing. Hospital workers being burnt out is a real thing. And oftentimes I was just hugging coworkers, encouraging staff, and it was definitely hard. So seeing families, that one visitation in our community is a problem.
Yes,
it's rough, because how can you tell grandma and one visitor, and it's rough. And so but for the protection of everyone, you don't want to spread it,
right.
So are there any other events? We talked about the one, and I will make sure that I get that information and post it on our page. You have your monthly food distribution with Famicos that falls
the last Thursday of every month. So it was today. Hence my appearance at the way I look today.
You look beautiful.
Thank you. But it's the last Thursday of every month, and the next one will be February 23rd. Wow. And it is from 10 a.m. to 1 on those days at the Health Multipurpose Center, and it's at 8555 Huff Avenue in Cleveland, 44106. And if you want to just find out information about other events and things that are happening within Famicos throughout our service area, you could always log on to famicos.org for that information, or you could follow us on Facebook and Instagram at Famicos.
Yep.
And all of our information is our marketing team does a heck of a job.
They do.
Putting all of our flyers and things out there about events and things that are happening. But let's see, we have the monthly food distribution, and I know our community health workers are working on events to do lead education for parents. They're also working to do, they're having workshops there's going to be one on February 23rd, the same day that we're having our food distribution, with a doula. That's coming in to talk to expecting moms about how to care for yourself and your new baby. So that's going to be on the 23rd, and they're having one every month in February. I mean, every week in February, starting the second week of February.
Okay.
So I will make sure that I get that information to you.
Okay.
And let's see, what else is there?
I just love how you all are about the community. I do follow you on Facebook, and by the way, when the Famicos bus was in the Glenville parade, I was like, I was hitting the button. I said, "Go Famicos!"
Yes,
you're
yes,
everywhere,
yes, yes.
wherever the community is.
That's right.
I love it.
Yeah. So, there's going to be a mammogram bill at University Tower.
Okay.
And that address is 1575 East Boulevard in Cleveland, 44106. And that's going to be on Tuesday, March the 7th, from 8 a.m. to 5 p.m. And anyone that's interested in taking part of that, they can call 216-510-3019, or they can email health@famicos.org for information. And our community health workers will help arrange those appointments for you.
That is awesome.
Yeah. So we're going to be doing quite a bit of stuff.
Oh, that's
awesome. I'm
awesome.
excited for what 2023 is going to bring for us.
Yes, absolutely. And yes, and we'll make sure we post that too as time gets ahead, especially if registration, or so that you can know, because I'm sure, with the line. I did come to that parking. I can't remember how parking is at that. That's the one, the University Towers, of getting, like when the community comes to that event. That's that one that's around the oval.
Yes, it is.
Parking can be a little challenging, but we will make sure that we.
I'm sure that they'll make accommodations for that. Yeah.
So we got time, because that's in March.
Yes.
Okay. Anything else on your? I'm looking at my notes. I think we.
No, I think we covered quite a bit.
The weather may have prohibited our councilwoman from.
She's a busy woman.
Yes, she is. We know that she is busy.
Okay, she said that we could get started. She's 10 minutes away.
And so yeah, with the weather.
Yeah, the weather's kind of nasty.
That concludes the Famicos part of Ward 7. So I would like to thank you for being here and sharing with me. And always a pleasure of working with you and shaping me and welcoming my bubbliness and
yes. I enjoy our work that we've done together.
Yes, absolutely.
Yeah. I think we met the first time at UMADOT. Was it at UMADOT? We
that
had the clinic.
Was, I think, or Huff Multipurpose Center.
It was
either
at the Huff
one
Multipurpose Center, and then we did something at UMADOT, and you had to give me a T-shirt.
A T-shirt, yes.
We won't say why she had to give me the T-shirt, but she had to give me the T-shirt.
It was right on time.
Yes, it was.
Well, safe travels. Do you go back to the office after this?
Headed back to the office after this.
And then safely home.
Yes.
This will conclude our podcast for now. Thank you for joining us today, and have a great day, everyone.